So, dear friends of the WBMT, I am here at the Department of Carl June at UPenn in Philadelphia. As you know, CAR T cells were developed here more than 2 decades ago at the Penn Medicine by Carl June, Bruce Levine, and David Porter and Stefan Group. I have the pleasure to interview Bruce Levine and ask him about history and current development of CAR T cells. Thank you, by the way, Bruce, to be available for this interview.
Yeah.
Could you give some insights on the history of CAR T development over the past couple of decades, please?
Yeah, so it was kind of a crazy story to begin with. In the mid to late 80s, when the structure of the T cell receptor and the B cell receptor was being described, there were independent groups that had the idea to say what would happen if we mixed parts from one to the other, right? And pretty soon there came about this idea of, well, you could redirect T cell specificity if you only graft a ligand onto this chimeric receptor. We discovered a way to very efficiently grow T cells and with collaborators to use a lentiviral vector to deliver the gene. There are other groups working on this technology as well. But what we had here at Penn that I think gave us an advantage was we had built a program that was very efficient at taking findings from the lab into clinical trials. And so we had collaborated early on with a company in the late 90s on CAR T cells in HIV. We began our preclinical work in cancer in 2004 and treated our first patients in 2010.
Excellent. So we had just a week ago an excellent 3-day meeting on cellular therapy called Silicon Valley. How is the field developing worldwide and locally? What is your dream?
Yeah, so Silicon Valley is a name that just popped into my head one day when I was talking to parents of one of our patients on what we're trying to build in Philadelphia, and it encompasses all of cell and gene therapy. So what's very exciting as far as CAR T cells now is we see an application in a whole other disease category, and that is autoimmune diseases. So we had Fabian Muller and others talk about that application at the meeting. Also, we had a session on in vivo CAR T cell therapies. If we think of the number of patients that have been treated so far, there are tens of thousands. To be able to reach hundreds of thousands or more, we have to think about ways to scale this. So if we could deliver the genetic material for a CAR with a virus or with a lipid nanoparticle, then we could reach that goal. There's also progress being made in solid cancers, and we didn't talk about it at Silicon Valley, but just last week, the news broke of effort here, collaborative between Penn and CHOP, of a custom designed gene editing for a baby born with a urea cycle disorder at Children's Hospital. So many exciting things happening with our Silicon Valley colleagues here.
Yeah, congratulations. You have almost every week a paper in the New England Journal of Medicine in the last 4 weeks, I think.
Yeah, well, that happened too. So that was last week, or no, it was a couple of weeks ago. And that paper described a shortened manufacturing process going from 9 or 10 days down to 3 days. But the other thing was IL-18 was included in the construct. So that could be locally delivered at the site of the CAR T cell engaging with tumor. And what we saw in patients that were refractory or relapsed after a commercial CAR T is 82% were overall response rates. So really exciting data in that population that had no other options. So we're continuing that approach and bringing it into more trials.
What is your dream
I think the dream is to severalfold to be able to treat every patient effectively. We know patients don't respond even to the existing commercially approved CAR T cells. To be able to expand in diseases and solid tumors and autoimmune disease and fibrosis, and finally to be able to expand into states, cities, countries, regions that don't currently have access to CAR T. That can come by teaching the technology, by encouraging development and training. But again, for issues of scale, I think we're looking beyond the ex vivo approach, and hopefully the in vivo approach for CAR T cells will prove effective. And then I think we'll be able to reach many more patients.
Your first patient was kind of history, and not only because actually it started to understand what are the complications of CAR T cells. That was, I think, almost 15 years ago. Can you just tell the physicians that are out there what is the message, what you can give them, especially if you have a complication which you never saw and which is not written in the book?
Yeah, well, so we treated several adults in 2010 and 2011, and then our first child in 2012. And she had a severe cytokine release syndrome that was beyond anything we had seen with the adults. With the adults, they had it and they were sick for a while and then recovered. And this girl was very sick. And this comes out of the collaborative nature and the infrastructure that we have here at Penn. So we were collecting serum day by day on this patient. We have a correlative studies lab that could look at the cytokines in the serum. And they were doing that day by day, and the levels in the serum of IL-6 were 10 times higher than we had seen with any adult. And so that data goes to Carl June, and light bulb goes off. By happenstance, Carl's daughter has juvenile rheumatoid arthritis, and he was tracking approvals of new drugs and knew of one in particular, tocilizumab, that bound to the IL-6 receptor. Now, contact Steve Grupp at Children's Hospital, said, see if your hospital formulary has this. Luckily, they did, but what does an oncologist know about arthritis drugs? So it was a strange occurrence, but again, a consequence of being prepared, having the infrastructure, and serendipity as well.
Okay, so thank you. And lately there was a song also about CAR T cells, which you are one of the authors. Can you explain this to us a little more in detail?
Yeah, so I wouldn't have predicted this, but we all receive inquiries about CAR T cells wherever we are. And I happened to be at a meeting in Ireland, and I got an email asking for information on CAR T cells. And it happened to be from a professional singer, dancer, multi-instrumentalist. So one day last summer, I had the crazy idea, what if she had her own CAR T song? And I sent her the words, and she messages back, OMG, I have my own CAR T song. Well, we worked on the words together for what was scientifically accurate and what was singable. And then she says, well, I'm going to send it to my Nashville band to record. And I'm like, okay, because I'm still thinking this is a little bit of a joke, but what came back was amazing. And you've heard it. And she recorded the vocals at Windmill Lane Studio in Dublin, where U2 and Rolling Stone have recorded. So it's called Ring That Bell. It's on YouTube. It's on every streaming platform, and hope you enjoy it and share it.
Okay, so thank you very much, Bruce. It was very enriching.
Yeah.
Thank you.
Yeah, thank you very much.